to tell you a little bit. I know that this has been in the news very much lately, as it should, the issue of mental health. But we wanted to explore the possible solutions and what was really happening in this community. And we actually started on this early last year, early in 2017, and I want to give credit to Capital Crossroads and also to Polk County for asking if we might consider doing a publication on this, and it went from there. In May, we actually decided it would be really smart to get a panel of maybe 4 people, experts, to come in and help us with the content so that we knew exactly what we were doing and covering, and it was very accurate. And that ballooned to 24 experts that came in for lunch at Business Publications, and they were fantastic. So I also want to give a shout out to all of the experts, many of them in this room, the organizations that came together and gave us so much insight and then provided sourcing for this publication. So I want to thank you for that. And lastly, I really want to just make sure that I thank the presenting sponsors, which is Polk County, Broadlawns Medical Center, Capital Crossroads, and Prelude Behavioral Services. You know, really, without you, we could not have done this. All the advertisers in here, it shows what you stand for, and that's important. And now it is my pleasure to introduce the new chairperson of Polk County Board of Supervisors, Angela Connolly.
Thanks, Chris. Well, this certainly is an overwhelmingly crowd. This is awesome, and we're thrilled to be here. Thanks to Partnership for hosting and making this really a public policy, as it should be. Someone said, is this a coincidence that we're having this today as the new legislation starts? No. It's not a coincidence. So thank you for being here. You know, we're going to get right into this panel, but I do want to recognize and say that mental health should be treated like any other health. We give a lot of accolades and do a lot of things for our physical health and means it's a quality of life. Well, if you don't have your mental health, it impacts your daily life every day. And so we really need to concentrate on not only every day on our physical health, but we need to recognize and help folks through the system of their mental health. So if anything happens today, I want to make sure that we always say physical and mental health is all about wellness together. So thank you, and I think I'm going to introduce Joe. Sorry, new twist.
Thank you, Angela. If you talk to Joe, you'll know why he's not up here. He has not much of a voice this morning. So I'd like to start by welcoming you to the Greater Des Moines Partnership for our Public Policy Issue Forum series. We kicked this off in August with a forum on water quality. We've hosted one on affordable housing, and our other one was on immigration reform. So this is our fourth in the series, talking about mental health, and clearly we have such an interest and passion from the community on this. So thank you for being here. To that end, we actually are streaming it upstairs, so if we get more attendees to come in, we'll be able to have them see it upstairs without having to come into this, what could be a little warm room in a little while. Also, we're going to record the event so that we'll be able to share it after. We know this is an issue that people are very passionate about. The goal of our Public Policy Issue Forum series is really to educate and provide an overview. So while we may get into some level of depth today, it really is to try and get more people involved in the discussion and to really target the business community because we are a business organization. Want to note on the bottom of your agenda, we really value civility and we are proud to participate in the Show Some Respect initiative. So please keep that in mind as you're here and listening to all the different perspectives, and please, when asking your questions during the audience Q&A, keep in mind that that's something that makes Iowa great, our Iowa nice mentality. So one quick, I mentioned the recording of today's event, and so with that, I'm going to introduce our moderator, Chris Conetzkey, publisher of the Business Record, who I think is coming up on a year in that role, correct? This is Chris's second stint at Business Record, was there before doing a job for ESPN down in Florida, and then coming back in 2011 to take on the role of editor. So Chris has been with us ever since, and as Chris said, they've done such a wonderful job with this new publication that we really felt like it would be a good partnership to work with business publications on this event, and those that have really worked to dig into the impacts and barriers that exist in the mental health systems. So with that, I will bring up Chris and let him take it away.
All right, thank you. Why don't we go ahead? You guys can come on up. All right, can everybody hear me okay? We good? All right. I was reminiscing and preparing for the event today, and I was thinking back to about June 2015. We held a power breakfast on the topic of mental health in business. And in preparing for that, that was a response to some of the challenges that were happening at the time. At the moment, back then, there was the Lufthansa Flight 9525, where a pilot had a mental health issue and crashed the plane. Been a few workplace shootings as well, and so we thought it was a good time to try to address the topic and talk about it and involve the business community. And I have to say, it was a great discussion. We learned a lot. I learned a ton through that process, but our attendance at the event was a little bit lower than most of our other power breakfasts. And in reflecting on that, the topic of stigma and the challenges that are related to mental health was something I felt was one of the reasons why it was a little bit harder to get people to come out to something like that. And I can't help but, I was talking with Matt Connolly, who was on that panel, Angela's son, beforehand, and couldn't help but stop and reflect and look at the packed room today, and can't help but think about the momentum that's on this front. The crescendo that seems to be there. We have leaders like Angela in the community that are putting this at the top of their list. And to see that stark change is something I'm really excited about. The reality is there's not going to be a silver bullet to this challenge. You all know that. Everybody in here is working on this in some fashion from a variety of different angles to try to address this challenge. So what we hope to do a little bit today is accomplish and just further the conversation. Continue that understanding and continue that momentum as we help kind of lift that veil around the topic. I know we've got a great panel that's going to do that for us today. And what I'm going to do is briefly introduce each of them. And I'm going to have each of you then share just a little personal story about how maybe you've been affected by mental health in your personal life and the perspective that you're going to bring to the conversation. And we do want this to be a Q&A with the audience. It says Q&A at the end. I'll get things rolling with a couple questions, and then from there I'll open it up so we can keep it kind of a little bit more free-flowing and get your questions so we can kind of see where you want to steer it today. So with us today, directly to my left, we have Carrie Clogg. She's the Director of Philanthropy at Come and Go and is a board member of NAMI. She previously was the Executive Director for the Civic Music Association and the Director of Foundation and Government Support for Simpson College. She's a member of the 2015 Greater Des Moines Leadership Institute and part of the 2014 Business Record 40 Under 40 class and was awarded Citizen of the Year from the Downtown Chamber of Commerce. She resides in Des Moines and has a husband, Josh, and sons, Sam and Charlie, who I'm sure she'll talk about a little bit. I should know Angela's name, I think. Supervisor Angela Connolly, you all know her. She's on a number of boards. I'm sure she serves with you in a number of on the Capital Crossroads and is part of the Tomorrow Plan for the MPO. Her vision on this front, she's made it one of her top priorities in her role as well. I'm sure she'll bring a lot to the conversation today. Next to us, we have Peggy Huppert. She has served as the Executive Director for NAMI since March 2016. Peggy has a long history of service to nonprofits in Central Iowa. She's a Drake journalism graduate who started her professional life as a reporter and editor. So you get to ask some questions to the panel today yourself, I think. That's how it works. She moved into the nonprofit world as a communications director. In addition to communications, she served as a development, government relations, and executive director for a variety of groups as Chrysalis Foundation, the Iowa Hospice Organization, the Des Moines Playhouse, and the American Cancer Society. And lastly, we have Dr. Janice Landy. Is the psychiatric section chief of inpatient behavioral health at Broadlawns Medical Center. Dr. Landy graduated from the University of Northern Iowa in 1985 after earning bachelor's degrees in psychology and biology. She's a 1990 graduate of the University of Iowa College of Medicine. Then she went on to the University of New Mexico and then to Bloomington, Normal, Illinois. She's practiced outpatient psychiatric there since 2000 and returned here in 2011. So with that, Carrie, we'll go ahead and start with you. If you could talk a little bit about your background and your personal story of how mental health has affected you.
Sure. Well, thank you for being here today. I really appreciate all the dedication and interest in this topic. I call myself an accidental advocate in that I really had no interest in advocating for mental health. But I have a son who is 10 years old and has bipolar disorder. So because of that, I am an advocate. I'm an advocate for him, and I'm an advocate for every child in this state who deserves to have a quality of care that is adequate for them to be able to function, get a great education, and be productive citizens here in Iowa. So thank you for being here today.
Hi, once again, Angela Connolly. I have lived experiences. My son suffered from a mental illness, and I know the struggles each and every day that a family goes through, not only the person that is suffering, but everyone around them. And to navigate the system and get people to understand that there's help out there, and the awareness and the stigma that goes with mental health is something that I've been trying to advocate for my last 20 years as a elected official. It's hard to have a voice when so many people don't listen, nor do they want to listen about mental health. So I think the challenge today, and I think the Business Record has done an absolute outstanding job. Everyone should read every detail, every letter, every point in this magazine, because it is worth so much for people to understand what mental health is really about and what our mental wellness is really about. So I know firsthand the struggles that people encounter when it comes to mental health. So I'm going to continue to advocate for change that we need to have in our community.
I've been with NAMI Iowa almost 2 years, and it's been an incredible 2 years. I also have lived experience. I have close family members who live with serious mental illness, and I've been dealing with it for 18 years. I think that we're probably the rule and not the exception. Up till now, at least, most of the people involved in this area are there because of personal experience, because it does affect your whole life. But we're not unique. So there's about 600,000 Iowans who, in any given year, will deal with a mental health challenge. It's 1 in 5. It's a lot of people. And it affects, as Angela said, 3 to 4 people usually on average, in addition to the person who. So that's a lot of Iowans. And about 137,000 Iowans live with chronic and serious mental illness. Again, a lot of Iowans. And I think that, to your point, Chris, of the changing tide that we're seeing, it's because a series of decisions over a period of years have led to a lot of people suffering. And so people are telling their stories, and elected officials are listening. So yesterday I was really excited to see the governor in her condition of the state prominently mention mental health. I know I was at the Capitol yesterday. There's a lot of interest on the part of legislators to deal with this significantly. And NAMI will be in the forefront of that. So thank you for having me.
So I've always had an interest in psychology, hence the degree. And I feel like I sort of fell into medical school. Didn't really know, I know that's a weird thing to say. But it's true, and I won't tell you the long story. I think that many people who go into psychiatry are called to the work. And, excuse me, I say that because for a long time, the same stigma that is prevalent in terms of other people or people telling their stories about having mental health issues, that same stigma was happening in the healthcare world. And so I actually had a professor in medical school, when he asked me what I was going to do, I told him psychiatry, and he went into a tirade about what a waste that was. So again, I think a lot of psychiatrists feel called to the work to sort of push through some of that stigma. Having said that, I think probably many of you are aware that there is a critical shortage in certainly psychiatrists, but really every section of mental health care: nursing, therapists, psychologists, line staff, and Iowa is always down at the bottom when you look at national rankings. So I'm thrilled that there are so many people here today who care, because really it's that larger culture shift that's going to help us make a difference in Iowa.
What I'd like to do now, you heard a few common themes in there. We heard stigma, we heard about the psychiatric shortage and some of the things that are preventing us from being able to provide that care. If you could each take a minute or two to talk about one of the biggest barriers or roadblocks to providing mental health care. Let's start there, and we'll kind of work off of that, and hopefully by the end we'll be able to talk a little bit about some possible solutions and some things that are being done.
Well, okay, so I've already mentioned the shortage of staff and professionals to provide mental health care. I think that is a huge and critical barrier. It's very frustrating for people. You'll hear stories here, I'm sure, about when people do come to the point where they want to seek help, and then they have a wait list of 3 months, or they can't navigate to figure out who they should even see in the first place. So I really think that that workforce issue is one that we are going to have to address quickly if we want to solve other facets of the problem.
Can you talk a little bit about why there's that shortage and what's maybe led to that?
So I think that rural states tend to struggle more than urban states in terms of psychiatric workforce. And Iowa being as rural as we are, I think there's something like 60 counties in Iowa that don't have a psychiatrist. Some of that, we are in the process of starting a residency, but that has been a journey in part because the federal government isn't funding additional residency positions. So this really is a situation that has federal, national implications that then trickle down and very negatively impact us here in Iowa.
Peggy?
I'll just add to that certainly one of the barriers is reimbursement. The stigma that Dr. Landy mentioned extends to how mental health is paid for. Psychiatry is at the bottom. And, if you've all noticed that there, a lot of hospitals have really nice cancer centers and heart centers and arthritis centers. And have you ever seen a really nice psychiatric center? Besides Broadlawns. Besides Broadlawns. There's a reason for that, because they lose money on psychiatric services generally, and Broadlawns is a public hospital, so you have the exception, but that is definitely one of the issues. The stigma extends, as Dr. Landy said about her experience in medical school, to how it's reimbursed, and then Iowa is at the bottom of the bottom in terms of reimbursement rates. So that's part of it. I also think that it's been years of neglect and apathy on the part of policymakers. They haven't made this a priority. Another piece of it is our history in Iowa of funding and planning adult services through 99 counties. That dates all the way back to county homes. And very few other states have that system. And it has been challenging to advance and have an integrated, modern, sophisticated system. And we've certainly made progress, because now we have 14 regions instead of 99 counties. But it's still not an ideal way of funding and providing for those services across the state. And then there is no children's system, which I'm seeing a lot of my children system friends out there, and I would be remiss, I'm sure Carrie will talk more about this, but there is no children's system. It's never developed because of the way that adults were separated out and were the responsibility of counties. So we have a lot of structural and systematic challenges in Iowa to face with. This is a problem across the nation, it's true, but in Iowa we have some unique challenges.
Dr. Landry, before I go on to Angela, you talked a little bit about the reimbursement component. Can you just talk about how that affects a hospital and the dynamic that provides, and maybe go a little bit more in depth into that?
I think Peggy covered some of that really well, but you know, hospitals at the end of the day are businesses and have to fund all of the services that they're providing. And so this country likes to pay providers to cut people open and scan their bodies and do lots of procedures. And so that's why you see things like
And to cure.
And to cure. So you see orthopedics being very big and cardiology being very big, and you know, for most hospitals, those services help to fund the psychiatric services that are provided. You see units closing all over the state because a lot of them don't have those resources to help shore up the mental health care, which means that we have a critical shortage of inpatient beds. At any given time in our ED, we could have, at one point a year ago, we had 18 people in the emergency department or on the medical surgical part of the hospital who were waiting for an inpatient psychiatric bed. And that's, you know, one moment in time, 18 people at the hospital waiting. So I think that, you know, again, we've both said that's really the funding piece is an issue that's going to have to be addressed. Did I answer your question?
You did. Thank you. Angela?
Well, besides those two very important issues about reimbursement and all that goes along with that, it's the stigma, really, that I believe is a big obstacle and a barrier for a lot of us in the state of Iowa. People don't want to talk about mental health. I mean, this is the first time the leadership in a business community is actually having a forum, besides what Chris announced that he had a couple years ago, but not very many people showed up. It's unfortunate that tragedy has to happen in our community to make this really alive. And that's really why we're all sitting here, because there has been tragedy after tragedy, losing our young people to suicide and other mental health crises. And now people are starting to pay attention. That's awesome. I just hope we don't forget. So we need to keep talking about it in our workplace and in our neighborhoods. When I go out when I talk to my neighborhoods, I bring up mental health and the funding issues that we face every day. I think another huge challenge is the way that we're delivering services. Now with this privatization and we only have one MCO, it is very difficult for folks that have had the same case managers for years and years, and now there's a change. Do you know how that disrupts their life and everyone around them? It is a true tragedy what is happening in our state. and we need to fix the problem. And unless we continue to talk about it like we are today, and people go to advocate for change, it's never going to happen. But we need to continue the change, and I think stigma is the hugest barrier.
Carrie?
Well, I'll just tell you briefly about my experience, and Chris asked about access to care. My first son is the one that is affected by mental illness, and when I first knew he needed some help, he was 4 years old. So what you do as a parent is you go to your pediatrician, of course. And I'll never forget that visit because I told her what was going on and things I was observing and asking, you know, is this normal? Is this normal? Because you're a first-time parent. And said, I think he needs maybe to see someone for his mental health. And her eyes just kind of shot up. And she said, well, he's 4 years old. And I said, I know, but I think that I'd like to be proactive in this. And she said, you know, if he were having a sight problem or a heart problem, I would give you a list right here of everyone to refer you to, and you'd have an appointment next week. I can give you some names of some therapists, but I'm not sure when you would get in. That blew my mind. As a parent who is in charge of taking care of someone, I just really didn't believe that was true, to be honest. And so I did make that call, and it did take about 5, maybe 6 months before my son could see a therapist. And, you know, he was not in crisis at that time, but there have been times where he has been in crisis, and there has not been people who would see him. And that does not happen in other health circumstances with our kids, and there's no excuse for it.
When you talk about the stigma component, I think that's a part of that. One of the things we spent some time talking about on the phone was the difference on how we treat somebody with mental illness versus somebody who's sick. I wonder if you could talk a little bit about that and some of your experience on that front.
Sure. Well, it is difficult with kids because, you know, my son does now, he's 10, he understands and can really well articulate about his condition. But, you know, his friends and his peers, it's still very foreign to them. And a lot of his symptoms, and I call them symptoms, come out as behavioral challenges, and they are. So peer relationships are tough, navigating school, all of those things are very difficult. Well, he could, but it is much more difficult for him to say, well, this is the result of my mental illness. Whereas the other child in his classroom who is in a wheelchair, no one blinks an eye when they make different accommodations for her, or do other things in order to help her function through her day as best as possible. And there's no reason that those same sort of accommodations and discussions can happen in that classroom to help, and I know my son's not alone in that classroom, get the education that they deserve.
I wonder if you could talk a little bit too about how we talked about people distancing themselves from somebody with a mental health issue. So not just children, but adults as well. Angela, if you could talk a little bit about that component.
Well, when my son, which we didn't know was wrong, I kept saying he wrestled in high school. So I thought for sure there was something going on in his brain because he wrestled. Or maybe he got in too many fights. He was very difficult to be around. He was scary. Nobody wanted to see him. He would say strange things. He would do strange things. But as a mom, you always want to love them, no matter what. But the people around him, they didn't want to be around him, and it hurt. And so I know that the stigma is really there. If he had cut his hand or head or hurt himself in some other way, other than the fact that I really thought he had a brain injury until he got properly diagnosed, people would reach out. But everyone backed away. And it is scary sometimes to be around a person that is in a crisis, that is really suffering from a mental illness. But we need to wrap around them and help them just like you would anyone else, and continue to love them and guide them. And while it wasn't the easiest, and it was probably one of our biggest challenges in our family, is to deal with someone that was very, very sick until they received proper treatment and help, and the key, properly diagnosed. But to navigate that system and figuring all that out, that took months and months. But I believe that we had a miracle happen, and we are very, very fortunate today. Hats off to my son, Matt, that navigates very, very well.
Peggy, was it you that, when we talked earlier, talked about the casserole?
Yeah. So there's a group of moms. It was started by Tammy Knighton, who's an activist from, she lives in Iowa City, and she's a professor at Cornell. Started the online support group called the Casserole Club, which I think, Carrie, you've been a part of. Yeah. And it was so named because she said, when your kid has cancer, or people hold a fundraiser for them and they break their leg, or they have some other physical illness, people bring casseroles to your house. But when your kid has a serious mental illness, no one brings casseroles. So we're going to have our own casserole club. And it is a real issue, and there's a lot of people who suffer alone and in silence because of the stigma, because they don't feel the support is there. So that's something that everyone can do, is to be aware and reach out and offer support and say, how are things going? How can I help? That's what NAMI does, offering classes and support groups and learn about illness, but it can be done informally as well, and the workplace is a really good place for that to happen.
Well, I think that's a good transition too. And when we've been talking about a range of healthcare, mental health care challenges. There's the extreme cases, and then there's anxiety or issues where people aren't able to function as well at work. I wonder if you could talk a little bit about maybe the effects on a workplace and what might be happening from the business perspective too.
Well, depression is the #1 reason for employee absenteeism in the nation and loss of productivity. But there's not a very good awareness because of how it presents itself. Because along with depression actually comes actual physical illness often. And I also want to point out that mental illness is actually a physical illness. When you look at the brains of people with schizophrenia or bipolar disorder or major depression in a scan, they look different than the brains of other people. I'll never forget, my husband went through some therapy and process, and a psychiatrist was saying that, and he showed a bunch of different brain scans from different people, and it was such a revelation. He said, my brain looks different. So it's not that you don't have discipline or willpower, or you have a personality flaw, or you had crappy parenting, or you don't have enough faith, or a lot of the things that have been said about why people have mental illness in the past. It actually is a physical illness, and people should recognize that.
What I'd like to do now is go ahead and open it up for some questions that should have a variety of things that we've talked about. Anybody have a question for the panel? That's right in the back there.
Thank you to the Greater Des Moines Partnership for recognizing this issue. Of course, as the National Association for Professional Social Workers, we think of it as a professional workforce issue, but it really is a workforce issue in general. I was wondering if anybody on the panel has any good tips for how we can bring those business partners along with us and have them help us advocate for better services when we're facing such a budget crisis here in the state.
So the question, just to make sure for our video, is are there any tips on how we could bring along the business community to be advocates, especially given the budget constraints that we're facing as a state?
Well, as I said earlier, I think the main thing is continuing to advocate at the Capitol. That's where it starts. We need to let them know the crisis that we're in. And for workforce, it's not any different. We talk about skilled workforce, that we have a shortage of skilled workforce. We have a shortage of health professionals. And the state does not recognize that often. And they need to continue to hear it over and over again. It's the workforce piece that we're missing. Dr. Landy said it with psychiatrists, prescribers, you name it, there's a shortage. And, you know, hats off to, thank God the social workers exist. They're not paid very well, and there's definitely a shortage. So I think we need just to continue to advocate at the Capitol on all these needs.
I would add that I think it makes a lot of sense for business to be involved with this because it's a workplace issue, it's a productivity issue, it's investing, it affects almost everyone, whether you realize it or not. And if it starts at the top, I talked about how NAMI is involved in a lot of military bases because we have a program called Homefront. And what we found is that if the chief military officer on the base says, my family is participating in this program because we believe in it, guess what? The other people on the base will as well. If he says this is not going to hurt your career, this is, in fact, I see it as a positive if your family participates in this, then it'll happen because it starts at the top. So if leaders of businesses say, we recognize that mental health is important, they invest in it, you make sure that the insurance coverage that you have has parity, meaning it pays for mental health services on the same, which is the law, but isn't always followed, and says, my family deals with it, and so I'm here to say that we're going to help all of you deal with it as well. That is huge. I think that there's, you know, a lot of examples of some good things going on, and I wanted to call out, I see there's some people here from DMU, and we have a really cool partnership that we're starting with DMU. They've decided to integrate NAMI provider education into their medical school curriculum. So starting this year, they're doing a smaller pilot program, but starting next year, they're going to have 15 hours of education for their third-year medical students about how to treat people with serious mental illness more effectively. And this is a national best practice, but this will be the first medical school in the nation to do this. So it's a really big deal. And since family doctors prescribe 2/3 of all psychiatric medicine, it's a really big deal to help them be better at that and to deal with people coming through their door every day who need their help.
Another thing to consider about workforce is retainment. If parents cannot find providers in this state, they will leave this state. And I will be 100% honest in saying that I have thought about doing so. And I'm a native Iowan, and I don't want to leave this state. But currently my son's psychiatrist is in Chicago. So I travel every month for him to get care. So the time may come where I have to leave the state. And both my husband and I are employed, full-time people in the workforce here. And I honestly believe that if we don't provide the care for kids in this state and adults, how are we going to get people to come here? And how are we going to get people to stay here and want to work here if they can't get health care that they need?
Peggy, you talked about CEOs against stigma at some point. Just throw that idea out there.
Oh, yeah. This is something that's been done in a few other states, CEOs against stigma. And it's something I want to pursue here in Iowa at some point. It's just exactly what I was talking about. CEOs of companies, business owners and leaders taking leadership and saying, this is an issue we all need to deal with, talk about openly, and try to make it better.
More, yes, right up front.
I'm Nancy Goebel with Place, and the three of you that have had personal situations with mental health in your family, you all spoke to the difficulty of knowing what was going on with your child, of knowing where to go and finding And where we've seen an increase in these forums and in more of a government's role of awareness, the parents themselves are still not knowing where to go. And so they end up with things getting worse before they get better. And I just, I think of a more comprehensive, we need to put together, what would your thoughts be about putting together a comprehensive media push on community awareness about mental health, where parents can go, what to look for. Parents don't know what they're looking for. And I liken this to about 25 years ago, I was part of a task force that worked on domestic abuse for women and where women could go for help and they didn't know. And so out of that came the question that is common now and posted in doctors' offices is, do you feel safe? And so, you know, I liken it to where's that kind of message to families for their kids? Are your kids hurting? Are your kids happy? Do you know where? And what you said, Carrie, about the pediatrician being the first spot for help. So I'm just wondering what your thoughts are, how we would put resources together so that we're actually reaching those parents. We have to get the legislators, but we have to get to the parents.
Yeah, so the question we're looking at is what would it look like for us to put together a media push in some way or raise awareness, especially at the parent level, and also maybe just to tack on to that from the continuum of care component. I think that might be where Angela's going to go a little bit here.
Well, thank you, Nancy, for that question, because shame on us for not letting people know really where to go and how to access. And we need to do a better job. I mean, I'm sit on the board at the Polk County Health Services, and I'm just amazed that there's so many people like you and others that leave our state because they can't navigate and they can't get help. So Polk County is going to start launching a public awareness campaign next month regarding mental health and really posting numbers where you can go get help, all of the providers, a lot of them that are in this room, telling them what they do and what they have to offer. We'll have cards for all police officers to hand out because many times they are the front line that visits the folks on the street and they need to know. Some of them don't have a clue. You know, they just take them automatically to the jails or to the emergency room. You know, we've done a lot of diversion programs in Polk County, but people don't know what they are. We need to let them know what they are. So one of the things, as I said, we'll be launching is really hopefully a comprehensive public awareness campaign on where to go and how to navigate the system. And our doctor's offices, we need to do a better job of letting them know that we have a 23-hour crisis center, that we have mobile crisis available to us. And we need to really get the message out on what programs we do have in place currently.
Chris, if I could follow up on that. So there was, from the statewide perspective, I was part of a work group called Complex Needs Work Group that met from August to December to talk about the gaps in our mental health system. And we've come out with a set of recommendations, which is now, if you go to our website, it's on there, NAMIIowa.org. And we are getting a bill drafted of the legislature. It's a comprehensive set of recommendations that, if enacted, would make our mental health system much better. But one of the little gems in it is a statewide 800 number that anyone could call, adults, parents of kids, to get help. And like 800 Bets Off, which everyone knows, it's widely publicized, all the counties, all the regions are required to have crisis lines, but they're all different. And people don't always know what region they live in either. So it's not widely known, where should I call? But that's one of the things. There's a lot of others too. So I just recommend, if you're interested in moving public policy forward, take a look at that and consider getting involved and talking to your legislators about moving that forward.
Angela, you talked a little bit about where people go when they're in time of crisis, and if they don't get the care, they often end up in jails. Can you talk a little bit about the effect on the county and the state and the kind of repercussions that might have?
Well, most of you may or may not know, 45, sorry. most of you may or may not know, I think there's like 45% today in our jails are suffering from mental health. And, you know, that's just not a way to solve the problem. It's costing all of us a lot more money as they sit in jail and wait trial and maybe never get help. That's costing all of us millions of dollars every day. The transportation costs to get people, because they have to travel sometimes to another hospital to get help before they're adjudicated. That's costing our sheriffs and our transportation. Some say it's, you know, $1 million just in transportation costs. I haven't got those accurate figures, but I know it costs us a lot of money to house folks in our jails, in our emergency rooms, and really the whole system needs to be looked at, and we're hopefully going to embark on a data-driven justice where all platforms are talking to everybody. There's a lot of folks out there that continue to use our services over and over again, and they're really not hooked up to any system, any help. So we need to find out who those high utilizers are so that the cost of all those services can start to come down, and we really provide them the necessary wraparound services that they need, whether it's housing, which is a huge issue for a lot of folks with mental health, transportation, and, you know, we continue to hear that through the MCO, I used to say MCOs, but now it's MCO, they're cutting off transportation for folks that have done it for years and years, and parents are struggling, families are struggling trying to figure that out. So there's a lot of costs associated with people with mental health, and we've really got to get a handle on it.
We got a number of questions. This is good. I'm gonna go green shirt right in the front there. Yeah.
Thank you very much. I'm Joshua Kubayasa, and I'm a student of UNI studying public policy. I'm so glad to be over here with you guys. And my question to you is, how can the rest of the state help to see how the job and then job role can be, we can make that possible?
Well, thanks for asking. He was asking about how the rest of the state can be, you're a student at UNI, right? You said the rest of the state, people can get involved with advocacy and getting laws changed and making things better. And I'll just put in a plug for NAMI. We have a grassroots advocacy network of almost 500 people. We do a weekly update. We have a team of lobbyists up at the Capitol. We're going to have our Day on the Hill on February 21st. And I invite everyone to get signed up and join us, because we're making a difference. NAMIIowa.org. Go to the website and sign up, and you can become part of our grassroots advocacy network.
Additionally, for people who don't live in the Des Moines community, even those who do, there are local chapters of NAMI that do great advocacy work right in the local community. I'm a consultant for NAMI Greater Des Moines, so get involved on the local level too.
More questions? Let's go right there. You got it.
My name is Don Master. I'm on the NAMI Greater Des Moines board with Dr. Landy, and I have a 24-year-old son, and we've battled mental health for 24 years. And when he was young, the stigma was he had ADHD. So, you know, the real solution has been he spent time with Broadlawns. He got diagnosed. He got out of medicine. He graduated from welding school last week. So, there's hope. Two things. Peggy, when's the NAMI walk?
Well, thanks, Don. September 29th is the NAMI walk, and we're aiming for 1,000 people this year to come out. We had over 800 last year.
And where's it at?
Terra Lake Park in Johnston.
Okay, so NAMI walk. Put it on your calendar, or get your checkbook out and write a check. Okay. One of the best things we can do is do that. Number two, in my real life, I work with employers. distribute NAMI Iowa, NAMI Greater Des Moines information to the rest of your employees, or print off the newsletters and information, put them in the break room at your office. We can all do something today to help with this battle, to where we go back to work after this meeting. And finally, Angela mentioned the cards. We have conversation cards, and we have them up front on how to talk to somebody with a mental health problem, do's and don'ts. We're distributing those through NAMI Iowa and NAMI Greater Des Moines and Polk County, and we need to get them out. So myself and Teresa, we have that information. We'll pass them out to people as you do. So thanks everybody. NAMI Walk, be there, everywhere. Thanks for everything you've done.
You go right up front here.
Yeah, I'm involved in some business organizations, associations, and I know one of the big thrusts is cutting taxes. And my question is, first of all, my first question is, how in the world did you get the Greater Des Moines Partnership to talk about mental health? Because I think that's a real positive. Secondly, how can we do that to the largest business organizations in this state, which comes out constantly for cutting taxes?
The question is in relation to how do you get the business community, when there's a tax cutting environment, to be thinking about ways to still fund mental health. Angela?
I want to put a plug into Capital Crossroads, because the partnership has sponsored Capital Crossroads. You know, we have 10 capitals, and part of that is wellness. And one of our big challenges and that we're looking at is mental health. So because of that capital, it's sitting in this room under the partnership, and they recognize that this is an issue and that we want to continue to talk about it in the business community. Because without the business community, it's great to have parents and advocates go to the Capitol, but we need to make this a number one priority in the business community. And I think they have done that, and thus that's why we're sitting in their room and part of the Capital Crossroads. It's important in our community to recognize mental wellness.
Let's go right here in front.
Thank you so much for having this forum. My name is Stephanie McFarland, and I am the new Behavioral Health Services Coordinator for Des Moines Public Schools. But I've worked for the district off and on and been a provider in our community for mental health for a long time. And mine is, I think, a little bit more of a challenge rather than a question. Carrie, I was so excited to hear what you talked about your child when he was 4. Because as much as we talk about stigma in adulthood for treatment, as well as our mental health crisis for our adolescents, with suicide being the second highest issue with that age group, what to do with elementary school students when they're having behavior. We have people who don't even recognize that infant and early childhood children have mental health. Our medical providers often don't. And so I'm a part of a workforce who is increasing that presence for treatment in my private practice, as well as the work we're doing in Des Moines Public Schools. So the challenge is let's not leave early childhood out of the conversation, as well as our underrepresented folks, where stigma can be even a higher issue in our communities of color, our immigrant and refugee population as well. I have neighbors who have lost their children who have lost their parents because they've been removed from our city. I can't imagine when police show up for an adult who has a mental health issue, that now we're actually going to be talking about the children who are left in the home. And that to me is really wonderful, that we're recognizing those folks who cannot speak for themselves. So that would be my challenge.
Yeah, I couldn't agree more. There's not a time that I'm not at a doctor's appointment that I think, if this is hard for me to understand and I have a master's degree, what if I did not even speak English as my first language? I think that every time. So you're absolutely right. Thank you for the challenge.
No questions? All right, you had the quickest draw in the blonde hair. Yes?
I'm Clark. I'm the CEO of the Johnson Chamber of Commerce. Happy to host the NAMI Walk coming up. I represent about 265 businesses in the city of Johnson, and I belong to the partnership. And I realize why we are in this room is because it is a business issue. So I'm happy to see so many of you recognizing that, but it's also an economic development issue. And I want to draw those lines for you. I represent several Medicaid providers, and I'm glad to hear Angela bring up the crisis that is looming over our state with So sometimes we need to talk about it in terms of the economy. Medicaid providers, healthcare providers employ tens upon tens of thousands of people in Iowa. If they close doors, if they close programs, if they cut staff, that affects our cities, that affects jobs, that affects our economy. These are drivers of the economy, Medicaid providers, mental health service providers. So my question to the panel, I guess, is kind of around messaging. How do we tailor our message to some of these audiences that may hear more of an economic or business argument as opposed to a family or a heartstring sort of argument, which I certainly, you all can sense my passion, I certainly believe has a place. But sometimes if we want to move the needle, it might come down to making the argument that we're talking about a literal loss of tens of thousands of jobs if this Medicaid situation is not rectified. So I just want to put that out to the panel as they close the room about how we talk about the mental health crisis that's facing our state.
Well, I think we've got that on video, so we can just use that as a nice little clip. You want to try to take that one?
Yeah, could you come to the Capitol with me, please? Well, it's well said. It's exactly what you said. It is a workforce problem. I hear from providers that they've had to refinance their business, mortgage to the hilt, all sorts of horror stories, from Link to consumer advocates to people that are really maybe going to shut their doors. And they do host a lot of folks that have jobs. Not only are consumers that have jobs, but people that actually work for the facility. Those people will move, and they will no longer be in Polk County. And it is an economic crisis. The governor and the legislature talk about, once again, the skilled workforce. We need to talk about this workforce. What happens to the people that can't get, our folks that can't get treated? They're going to move away. And we need to do a better job. And I think that's why the partnership will help us get that message out, that this is not only a crisis for the consumers, but it's also a crisis for our business development.
And I would like to add that an important policy thing everyone should be aware of is, I mentioned that adult mental health services are funded through property taxes, right? A lot of people don't know that and don't understand that, but they are. But 3/4 of all mental health costs are paid for by Medicaid. So the county part is important. And by the way, Polk County, we're stuck with a dollar cap on the mental health levy from 1996 that we can't get lifted because of the Iowa Farm Bureau. And I'll just say that, okay? It's true. And the legislators care more about currying favor with the Iowa Farm Bureau than they do about making sure counties can levy enough money to pay for mental health services. That's just a fact. So when you're talking to your legislators, you might bring that up. But another point is that Medicaid is important. And if they're cutting services, they're not paying providers, they're shortening lengths of stay, all that is going on. And it is creating a huge ripple effect.
Dr. Landry?
So I think it's also important economically to recognize that right now, as Angela alluded to, way too often we are taking care of persons with mental health issues in the most expensive settings. And so really it's cost shifting because somebody pays for that. And if people could recognize that at the end of the day, somebody pays for that, and that somebody is probably me and you and you and you. Let's do that in the way that is most economically efficient. Then maybe we could make some push.
Can you take us into the weeds just a little bit on the Medicaid component and what that means for the hospital and the actual numbers on mental health? Is that what's the percentage of reimbursement? Just give us a little bit of an overview on that.
So a lot, certainly the majority in most settings of mental health services are funded through Medicare and Medicaid. The private payers often pay a little bit better for those services, but the rates in Iowa are very low because, and that's sort of across the board in medicine, because Iowa is efficient in how we provide care, and so we get penalized for that essentially. But you know, any place that is providing mental health services, like I said, the vast majority is coming out of Medicare and Medicaid, or the person has no funding at all. So, as we've said over and over, right now it's very difficult to stay afloat financially in providing mental health services.
If I understand right, if over time you're depending more and more on the Medicaid component, you're having to raise rates in other areas to help ultimately.
Somehow, like I said, you know,
Right.
I think people have this magical thinking that maybe if we don't pay for it, the problem just disappears. And obviously that's not the case.
And just to follow up on that, Chris, so, and that extends to law enforcement too, right? So Angela referred to that about 50% of people, actually it's about 50% of people in jails in this state, which is about 4,000 people, but also about 50% of people in prisons, which is about another 4,000 people, have serious mental health diagnoses. And we're paying for that. We're also paying when there are horrible crimes committed. And my friends in law enforcement tell me that, as one example, the murders in Bondurant that happened last spring, that tragedy is easily going to cost the system, the criminal justice system, in excess of $1 million. So that young man didn't get the help he needed. He killed 3 family members, and we're all going to pay for the aftermath of that, not to mention the personal tragedies of what occurred. So you're absolutely right. We're paying for it. We're just not paying for it in a very efficient or effective way.
More questions from the audience? In the back right corner there.
My name is Ron Berg. As a trailer behavioral services are backbone services. Every single comment today about reimbursement, stigma, access to care, workforce development would apply also to substance use disorder services in addition to mental health services. And particularly as one of Dr. Landy can talk about the co-occurring disorder, integrated care, both with mental health and substance use, but also integrated care with health care.
The question is if Dr. Landy could talk about the integration of care between substance abuse and mental health services and health in general.
Yeah, I would go so far as to say that at least in some places the stigma around substance abuse is even greater than the stigma around mental health. There's a very prevailing attitude that why don't you just stop? This is a behavioral problem and you can control it. So I very strongly agree that stigma is a huge problem in that area. I think that whole person care is ultimately going to end up being the most efficient, effective way to provide treatment for medical and psychiatric illnesses. You know, we have some co-occurring programs here in the community, but you know, certainly in rural areas, I think it's very uncommon. You know, services are provided in a very siloed fashion, and when you don't have that communication between people providing substance use treatment and people providing mental health treatment, it's not efficient, and lots of things can really go awry. If I'm increasing someone's medication because I don't know that they've relapsed and they're abusing substances again, that's obviously very poor care for my patient. So I advocate strongly for co-occurring treatment. The integrated piece, again, I agree. I think it's going to end up being safest for patients and ultimately most efficient if we're all working together. We have, Broadlawns is working with primary health care for an initiative to provide some consultation and assist their primary care providers in providing psychiatric care, because as you mentioned, a lot of psychiatric care is provided by primary care providers. I think, you know, we're in the early going with some of this, but I think that it's going to be a wave that will take us to much better care and treatment for patients.
More questions? Yes, right there.
Well, to get change, I'm sorry about your brother, but I think that bears on us on the awareness on where you can go and can't go. I mean, we do have a 23-hour crisis center for folks. I get calls all the time that it takes months to get in to see a therapist or a psychiatrist. And that's why we established a crisis center so that anybody, any time of the day, 24 hours a day, can go to the crisis center and to get help, to get triage. You'll get seen immediately. You'll be able to get triage on whatever is going on in your life if it's a crisis. Right now we've got it next to Broadlawns Hospital, so there's you'll be able to get help, as I said, immediately, whether it's going to the emergency room or seeing a psychiatrist or a nurse practitioner. At least there's somewhere, because we were finding out it's too much of a wait. When you're in a crisis and you need to get help, it's not 6 months from now or 3 months from now, it's right now, in real time. And that's why we established this crisis center, and it is working. There are people that are there every single day. It's almost like a timeout for folks that are in a crisis and to figure out what's needed.
What's the capacity like on something like that?
We have, I think, six recliners that are there for people, as I said, police officers, mobile crisis takes them, people walk to the site. The emergency room people are taking people to the crisis observation center because they don't need to be in the emergency room. Family members drop off and go see folks at the crisis center. So because it's at Broadlawns, you can stay usually even more than 23 hours, but normally it's 23 hours to move to something else.
Is that something other counties in Iowa have, or is this a unique thing for Polk County?
There's a few, but I think we were one of the first that started the crisis center. We took the model from San Antonio. If you ever visit the San Antonio site, they have done it right, and they have all sorts of services available for people with dual diagnosis. They have housing at the site. It's one huge campus, and someday, hopefully Polk County will be like that.
Johnson County is opening one.
Mike, surprised you weren't first today.
First of all, I'd like to commend the business record for this outstanding work that's been done on this publication, and I believe the lady that helped put it together is right in front of me right now. Yes. Should be recognized.
Jane.
I appreciate all the comments that have been made, and I think we have to all do what we can to help and support the advocacy you're talking about. Personally, my main focus is going to be on preventive services. I've been involved since its inception in the Life Fatherhood program.
later this year around that subject about good parenting and mental health, because you know, you're not going to solve all the problems with that, but there's certainly preventive services are very important. It's just like keeping your health well, right? It's the same kind of thing for parents. Parents need help. It's a challenging job today in the environment we live in. So, but thank you very much, and thank you for all the people up front and the leadership they're providing. So, I don't really have a question. Those are my comments.
We've got about 10 to 15 minutes left, and what I'd like to do is, if you remove the barrier of money and you had just your magic wand, right? Where would you, we talked about the crisis center, that's something you've done, but maybe some other examples from San Antonio, or what are some other things that could be done that we should be working on to help solve this?
Well, I can start. For me, it would be help in the schools. Our schools, they are with our kids most of the day, and they are in desperate need of training and additional staff to help these many kids that are in these schools function and get a great education.
I think one of the biggest challenges is continuing to a continuum of care where these folks and really wrap around the services with people, whether it's housing, transportation. There are so many needs that are challenged by the people with mental illness. And I think if we continue to look at it, that it's a wraparound service that we need to provide, we would be better off in the long run trying to save these costs down the road, like emergency rooms, our jails. People need to be educated, and we need to help folks navigate the system. That's why we're doing a public awareness campaign. But also, I really think it's important to have a continuum of care for our people that are suffering with mental illness.
And I would say, to expand on that, continuum of care across the state. So Polk County does a really good job of, yes, we have our problems, we have our challenges, but I'll tell you, if you compare it to a lot of the rest of the state, it's nirvana. There, in a lot of the state has no psychiatrists at all. There are whole huge areas of the state with very little in the way of providers or services. So my wish would be, if you take a look at that complex needs report and the whole, we have a chart that shows it, of the continuum of care that needs to be there, and a realization that most mental illnesses are not cured, they're treated. So it's not like a broken leg where you get it set and then you get the cast off and you're okay, you're fine. Mental health isn't like that. So it changes. You know, some medicine works for a while and then it doesn't. You know, new symptoms develop. It's a constantly changing challenge for both the person affected and the family members and people close to them. So there needs to be that continuum of care, and my wish would be for it doesn't matter where you live, what your zip code is, that you have access to it.
Dr. Landy?
There's a phrase, no wrong door, and I think that is a very helpful thing to conceptualize. People in crisis don't want to be put on hold. They don't want to be sent to 4 different people until they find someone who can, you know, tell them who they should call next. And so this idea that I can go to someone, or there's a one-stop shopping, a phone number, so that I'm not being passed around from person to person to person. And so even just increasing that awareness of what is available, I think would be very important.
We've talked a little bit about at the crisis point, but the longer term care and the ongoing care of psychiatric services, are there some thoughts or some solutions? I know you've mentioned some things on the state's trying to do or you guys are trying to do to get more residencies. Can you talk a little bit about the need of getting more psychiatric professionals here in the state?
Sure. So the state did recognize the need for more psychiatrists, and I think it was 3 years ago, started a grant program primarily for psychiatry programs and primary care programs. And so Mercy here in Des Moines was a recipient, and Broadlawns in partnership with Unity Point was a recipient. And so we are starting programs which, if we are all full, will be producing in a few years 8 new psychiatrists a year. So we're certainly hoping that that will be a significant help. The reality is that a lot of psychiatric care is provided by nurse practitioners and physician assistants, and so Broadlawns has a program, a fellowship, so that persons who have those backgrounds who want to get further training in psychiatry can come and spend a year with us and get some very intensive training in psychiatry. Again, we're partnering with primary health care. I think we have to get out there. If I can't be everywhere, I need to get out of the way of those who can, and I need to help everybody who is providing the care provide the best care possible. So, you know, helping to educate those mid-level providers is important. And lastly, I think telehealth is something that's kind of on the horizon. It's used in a lot of, especially rural settings, to be able to increase that workforce. But interestingly, a lot of those prescribers are not Iowa. It's, you know, someone who's out of state. So really the goal is to shore up our resources here in the state.
Carrie, you talked a little bit about some of the pros and cons of the telehealth. You're going to Chicago, and maybe just talk a little bit about what some hesitancies might be, and then also some positives.
I mean, first and foremost, if that is your resource, I am all for it. But there's something to be said about a face-to-face meeting with a physician. So for me, and I'm lucky to have the resource to actually go and have a face-to-face conversation and appointment with someone is important. But on the flip side, if the only option you have is a telehealth conference, then by all means, I think it's definitely a viable option for some people.
And Dr. Landry, talk a little bit about from the delivery side. I believe you said that a lot of times they want to meet in person at least first. And then there's still the demand of the time. I mean, you still have time that you're spending with the person. It's not increasing the time on the doctor's side.
Right.
Decreasing.
Right. So we don't have a lot of lab tests. We don't have a lot of x-rays that help us diagnose and guide treatment in psychiatry. And so a lot of it is based on having enough of a relationship with someone that they feel comfortable in sharing what's really going on with them. And so for me personally, I think that the video aspect of it makes that a little bit more challenging. You know, there are some nuances. You know, for instance, if someone has schizophrenia as a symptom, sometimes they think that the television is talking to them, and so a telehealth situation can have some implications for those persons. I fully agree that, like I said, especially in some of these outlying areas where there really aren't other resources, I'd much rather see someone, working with a telehealth provider than not getting any care at all.
We're just about out of time, and what next?
This has been a great event. What next after this?
You're good. You should be up here, be the moderator. You got the next question. So the next question, though, and that's a perfect segue, though, is when we're thinking about, there's a number of topics that we didn't get to today. My list of 20 pages of notes, right? And I see the hands out in the crowd. I know there's more questions to be had. And so I wonder if to wrap us up for today, you could talk a little bit about maybe if there's something we didn't address today, but also then what's something people could do? What's something that we could do on the next steps moving forward? So Carrie, I'll let you take a first crack at it.
I would just say listen, help break this stigma, bring the casserole, listen to the friend, and care for the child.
I love the casserole idea. I think today we challenge ourselves to meet with your CEOs of your companies, and they need to lead by example. They need to make sure that the workplace is safe and that they can recognize folks that have might be in distress. As Peggy said, depression is the #1 workforce problem in companies for productivity. So I think if one thing, we need to challenge our CEOs and make sure that they lead by example and provide the services that they should for companies. We mentioned insurance. There should be parity between physical health and mental health, but I'm sure some companies do not. So we want to make sure and recognize the fact that they're providing that help for their employees. I think that's something that we can continue to advocate for. Obviously, all the other things for stigma, I will continue to fight that probably till I die. And I hope that you all continue to make sure and wrap your arms around mental health.
Educate and advocate. Educate yourself, continue to educate yourself. One factoid from, the governor talked yesterday about how we're helping 150,000 more people access mental health services in Iowa than we were 5 years ago, and that's true, but it's because of Medicaid expansion, which is part of the Affordable Care Act, which has been demonized by a lot of people. So I just want to educate yourselves about how things are working, or they're not, and why, so you can be articulate, and you don't have to be an expert, but you know enough to be able to talk with policymakers and business leaders and thought leaders in the community. You're going to make a difference. And another thing I didn't get a chance to mention before was the importance of research, which, there's a lot about mental illness we don't know, because we don't know exactly how the brain works still in a lot of ways. And that's the reason why you have to try a medicine and see if it works, and then, well, it's not really working, so let's try something different. And then it takes 6 more weeks to find out if that might work. And that's part of the trial of dealing with mental health. When Richard Nixon declared a war on cancer in 1968, it unleashed billions of dollars in federal research money, which is why we are so much more effectively fighting cancer now on, individual level. We need that same effort at learning about the brain and understanding mental health. And that can only really be done at the federal level. So think about that in talking with your policymakers.
Mental illness does not discriminate, and I think sometimes people, it's easy to kind of think, well, that's someone else. That's not me. That's not my family. I think it's important to recognize that we've talked about how many people are going to be directly impacted and be diagnosed with a mental illness. But the reality is that most everybody in this room knows somebody who has a mental health issue or a family member that has a mental health issue. They have been touched in some way by mental illness. We don't talk about it, and so you may not know, but recognize that everyone around you probably is impacted in some way at some time by mental illness.
Thank you all for coming today. One thing that I would say is this publication goes much deeper into a lot of these topics. It's going to give you the tools to be able to have conversations with people, to talk about some of these challenges that are going on. And the one thing I would say is earlier today when I was talking with Matt Connolly before, I shared a story with him, and he said, thank you for being vulnerable. And I think that's one of those things where, like Dr. Landry said, people have dealt with these things. You're dealing with these things, and you know people that are. And so being able to talk about it with them, that's going to help us be able to talk about it more openly and talk about and remove some of that stigma. So thank you again. Can I get a big round of applause for our panelists today? Really good job. Great job.